Okay, well, welcome Lutheran Services in America community. My name is Kent Mitchell. I am the VP of Strategy and Innovation at Lutheran Services in America. I'm relatively new here. This is probably the first time you're seeing me or hearing from me, but honored to be with you today on this Strength and Service webinar about private equity in the health and human services sector, friend or foe. This is part of our Strength and Service series. I'm sure many of you have been on one or more of these webinars, but they're really laser focused on examining and tackling the unintended consequences and uncertainties in today's climate, all with the goal of helping move the organization forward. I'm getting a little feedback. I'm not sure if others are. Okay. I think it's gone away. So again, thank you for joining the Strength and Service series. What I love about this series is it's not only about strengthening your organization, it's also about looking at issues of national concern, looking at context, looking at environment. So they're very strategic. And that's what's really exciting about today. We have three experts on the call who can tackle this issue from multiple vantage points. And it's a complex issue. We're going to do a lot of learning today, and I hope you'll get your questions ready because they'll have a dialogue and then we'll give you an opportunity to ask questions. So with that, I don't want to delay. I want to get right to our experts. First, I want to introduce Stacy DiStefano. She is the founder and CEO of Consulting for Human Services. She has rich insight into how private equity is moving into the health and human services space and what nonprofit CEOs and leaders like yourself should know. So Stacy, thank you so much for being here today. And following Stacy's presentation, we'll also hear from Linda Timmons, President and CEO of Mosaic, a wonderful organization that's a part of this wonderful community, and George Klauser, the CEO of Alter ACO Incorporated, who has a lot of practical policy and innovation experience in this space around health and well-being. So we'll have plenty of time again for questions. And with that, I want to turn it right to Stacy for our presentation. Stacy.
Thanks, Kent. Appreciate it. Thanks, everyone, for being here. So I'm going to roll through our slides rather quickly. I know we're being recorded here for folks to have information to take away. I'll also mention that if you go to our website, which will be included in the slide presentation, you can download a free copy of our Private Equity 101 guide. You do need your email to have it sent to you, but we don't capture the email or send any kind of marketing materials whatsoever. So I welcome you to go to our website at consultingfhs.com, and you can get that resource afterward. Kent already gave a little bit about me. I'll just share that I have been a mental health clinician and in human services for almost 30 years now. I've worked from direct care all the way up to COO of a couple of multi-state provider organizations, in addition to having a son on the autism spectrum, who's 21 now. So understand our perspective from the parent perspective, as well as from an executive leader and a caregiver as well. And it wasn't until about 5 years ago that I started to really see more and more about private equity in our human services space. And I started to take a deeper look at what that looked like, and really talk to other peers who were equally confused, who they were, how VC is different than PE, and what they were doing in our typically nonprofit space. So we started to create a guide to help other organizational leaders understand, and we're going to go through about 10 of those slides today and talk through that, and then look forward to a robust conversation afterward with my colleagues. So Private Equity 101, we're going to start with the basics here, and feel free to ask questions through the chat or afterward, or even to follow up after this conversation. Always happy to have this discussion with folks. I think it's really important that we understand the operating differences and similarities and what we can learn from folks. So we put together some frequently asked questions. These are questions that I've received from colleagues at all levels, from C-suite to managers in the field. I think we have a little bit of an echo. I'm not sure. Folks want to mute all of their conversations if you're not already. Okay. So I think the first part is just to understand the alphabet soup, right? What is private equity investing? How is PE different than VC, which is venture capital? So I'll start a little bit backwards. Venture capital is a bit more like gambling on a good idea. Venture capital is money that's raised by a group of investors who invest in an early idea or in a business that's not quite making money yet. So a startup would typically be funded by venture capital, and they're investing in the hope that that will become a revenue generating company. We don't see too much venture capital in providers in our space. That's more in digital therapeutics and other kinds of startups and maybe tech services in our space. But private equity is really a group of investors that manage a fund in order to invest and make money. Very similar to a 401k or other kinds of saving bonds. The ultimate goal of the fund is to produce revenue for the investors. And investors can come from a variety of places. Those investors can be individuals, they can be companies, they can be insurance funds, they can be groups and companies that allocate money in different ways. There aren't just one typical type of private equity fund. But there's multiple who invest in services that are like to others. So maybe it would be dermatology and medical and long-term care, things like that. They could invest in manufacturing. They can invest in computers and startups and technologies, and all of the sectors in the world have some private equity investment attached to it. One of the things that I'll mention in regards to behavioral health investing for private equity is behavioral health is an umbrella, more of a category that PE gives a label to. And under that umbrella are mental health, substance use disorder treatment, IDD services, long-term care, and autism services. So sometimes when I say behavioral health, folks think that means mental health, but for the context of private equity, and certainly for this conversation, behavioral health is the umbrella of which all of the service lines fall under. So there's a few different kinds of private equity firms across the sector. We have mega funds, we have mid-market firms, and we have lower market firms. So a mega fund is a very large fund that invests in over 500 million and up. Provider organizations and companies. Advent Global is an example of a mega fund that is a $700 billion worldwide fund with offices all over the world that invests in every single kind of company across all the sectors. There are some mega firms that invest in large, what we call platform deals in our space. On the IDD side, that would be something like Savita. On the substance use side, that would be something like Pinnacle or some of the larger firms that treat with substance abuse. And on the mental health side, very large platforms, kind of like Oak Street Health and others that are, again, that 500 million and over. Most of the private equity investment in our space comes from what we call mid-market funds. And those are typically the 50 million to say $300 million companies that get primarily invested by one firm that leads an investment round or holds the majority stake in that company. That's what we see broadly across our industry in human services. Organizations similar to the members of LSA would be in that mid-market fund. And then a lower mid-market fund would invest in companies that are $20 million and under. So the smaller nonprofits kind of equal to the PE-backed of that size. So there's a couple different ways that a company gets that value or valuation. You'll often hear of folks saying increased value or multiples of value, and that's based on something that's an acronym called EBITDA. And EBITDA stands for earnings before interest, taxes, depreciation, and amortization. And it's really just a way to look at a profit and loss or a balance sheet with some of the pieces removed from it, so you can see more of a true profit or a true cash on hand system. So it's just an accounting term that's used. We don't often see nonprofits discussed in forms of EBITDA, but they can be. Certainly, we don't typically have taxes. But we certainly could have interest before earnings, depreciations, and amortization. So there is a calculation of EBITDA for nonprofits as well. But typically, EBITDA and multiples of EBITDA are the way folks talk about the value of an organization or an asset that they're looking to acquire or purchase or sell. The difference there, of course, is that nonprofits create value by providing services, right? They're mission driven. We typically think of nonprofits as no profit, which isn't correct, but sometimes we think of them that way. The goal is always to be revenue neutral or generating some revenue. And that revenue is typically invested back into people or services or a foundation or some form of the mission delivery, right? And on the private equity back side, the revenue is really often generated back into the firm as well, into the services, but there's a percentage of that, of course, that's allocated back to the shareholders or the firm that invested to begin with. So the big difference there on surface, while they both can be mission driven and they both can be run like a for-profit who want to generate revenue, the revenue is used back in different forms. So I think the biggest misnomer is that nonprofit is no profit. We all certainly know no margin, no mission. So we want to be able to create a profit for the services we deliver as nonprofit organizations. And there are well-run and well-intended missions nonprofit. And then there are some nonprofits we know of that are certainly not as well-run and not well-intended, just like there are private equity firms that are very much mission-driven and mission-based who happen to earn a profit. And then there's certainly the for-profit private equity backed that has the reputation of being profit-driven and not at all mission-driven. So, certainly those are categories and stereotypes that vary, but for the most part, private equity investors can legally buy a nonprofit. They would have to then flip that service into a for-profit service. So as you can imagine, if they acquired a nonprofit, there would all of a sudden be tax implications to that would hit that bottom line margin. So you'd have to make sure that the economies of scale or tucking that nonprofit into the larger for-profit would be more broadly profitable in a global way, because you will incur more costs to do that. Just like on the flip side, you can take a for-profit organization and turn that into a nonprofit if it's acquired by a larger nonprofit. So both of those legally can happen. There are lots and lots of regulatory and legal complexities to that, of course, but those are two things that are entirely possible. A few other frequently asked questions that we often get is, how does governance work, between the private equity fund and the portfolio company? And it works very similarly to how a nonprofit board works and supports the governance of a nonprofit organization. The difference is that on a private equity backed company usually have representatives from the PE firm on the board. There are typically directors appointed to that board that can provide levels of business acumen or legal advice or fundraising, very similar to a nonprofit board. And then there is often an independent board member who doesn't get kind of any payment or any kind of kickback, if you will, for being on that board. Many private equity boards are paid boards, not all of them, but many of them are. And certainly nonprofit boards, they could be paid, but they're very often not. I don't think I know of any nonprofit boards that pay their board members. But really, typically, they are the same in makeup. The purpose may be a little different, where the governance of a nonprofit board is much more focused on the mission and fundraising and the legalities of running the organization, where I would say generally the private equity funded board is typically driven on business acumen and ensuring that there's the highest profitability that they can possibly have. But they run very similarly, they meet very similarly, and both boards operate in generally the same fashion. That reporting cadence, of course, can be very similar, but I think there's certainly a different pressure point around profitability and profit and loss statements. I worked for many multi-state nonprofit organizations for the better part of 25 years, and I know that the mission and the service was always high on the list of discussion. And I was COO of a couple of those organizations where certainly the metrics were important, but at the end of the day, you wanted to be serving folks with the best quality possible. If you broke even or came in at a little bit of numbers in the black, that was a great year, but that certainly wasn't the most important thing in the organizations, nonprofits that I worked for. Conversely, on the private equity side, there is certainly kind of a functional driver of profit. right? So they won't go into a service unless there is the expectation of a certain percentage of profitability. And typically that is between 6 and 12%. I know in my nonprofit days leading organizations, if we came in anywhere between 1 and 5% profitability at the end of the year, that was a really good year, and folks were really proud of that. Private equity typically wouldn't even look at acquiring an asset with a margin of that size. It would have to be much higher than that. So definitely looking at different things from the lens of mergers and acquisitions as well. So where do private equity firms typically get involved kind of strategically and operationally as opposed to nonprofit organizations? And I want to say something about that term strategically, because sometimes when you read things about private equity, you'll hear if it's a strategic buy or if it's a financial buy, or a strategic play or a financial play. And what that refers to are, if it's a strategic asset acquisition, it's that maybe that private equity firm has holdings in a different service line and they strategically want to get into a new line of business. So that's typically where that term is used. They'll call it a strategic as opposed to a financial. A financial would be an operation that they currently have in a service line and they want to grow. So they want to acquire different organizations that do the same type of service to grow their platform. So that's where they would call it a financial or a financial buy. So those two things, the term strategic is different that way. So private equity firms typically get involved strategically and operationally, very similar to the way an executive team or a board would with a nonprofit organization. It's, any good board is typically eyes on, hands off. That's the term we like to use when we talk to board members, and that's pretty similar. I think they may be a little more hands-on when it comes to growth strategy and acquisition and management of the profit and loss statements. But operationally, boards typically don't get involved in the day-to-day operations of an organization any more than they would in a nonprofit organization. So a couple of things, resources that private equity firms do bring to bear. They come to the table when they acquire an organization with money. So you can invest in whether it's capital or real estate or electronic health records or improving your data systems or adding technology to service delivery. They are willing to invest in things that will get them a better return at the end and hopefully improve the quality of services at the same time. So they come in with money, and most plan to invest when they plan to acquire. They know they're going to have to invest somehow in that. Just as if you would buy a house, sometimes you buy a house and thinking, well, the first thing I'm going to do is redo the kitchen or improve the HVAC system. Very similar to the way private equity looks at an asset in the behavioral health space as well. Sometimes that's new leadership, sometimes that's tools and technology, but for the most part, that's always part of the play. The differences in how a nonprofit and for-profit operate, very little difference operationally beside that enhanced focus on the P&L. But service delivery-wise, very, very similar. I don't think you would notice a difference if you were a DSP or a manager in a nonprofit or for-profit. They operate services very similar, have to follow the same regulatory rules, all of the good stuff that nonprofits have to follow as well. So again, just as a quick overview, I've made this slide for us. Private equity is a general term just to describe a pooled money that acquires stakes in company. They raise money from a variety of different ways: individuals, institutions, insurance companies, endowments, etc. They pay for a stake in a company the same way we would pay for a home, right? With some combination of equity and debt. So just like we might have a down payment on a house and take out a mortgage, private equity firms have the same situation. So some folks think that they come in and they pay cash for the whole asset or the whole company. That is almost never the case. There's always that combination of equity and debt. And that is why we've seen in part why we've seen a slowdown in private equity activity over the past few years, because just as the housing market has slowed because it's much more expensive to get a mortgage now, it's also much more expensive to get debt or get a loan to be able to buy more assets. So we've seen that slowing with the economic factors as well. Private equity invests in more mature businesses that already produce profit. Unlike venture capital, that's more of a gamble on a good idea. They definitely look for growth by consolidation, improving a system as a whole, and adding what we call adjacent service lines to establish businesses. So with our consulting firm, very often we will get retained by a private equity firm who wants our what we call industry advisement or guidance around how to build a system of care. So they may say, okay, if we're looking at buying a residential care facility in behavioral health, what other things should we look to add to that to make it a more robust, complete system of care? Those are the kinds of conversations that they seek experts on, very similar to the way you might seek an expert if you were investing in a growth strategy as well. The size of the fund plays a major role in how that firm deploys capital. Certainly that makes sense. The larger it is, the more they can pay for. And I wanted to show you this sample just of the last 5 years. So these are behavioral health transactions over the last 5 years. And again, behavioral health in our umbrella, mental health, substance abuse, IDD, autism, and some long-term care. So over the past 5 years, there were 929 transactions in our space, with investors over 1,000 participating in those transactions. So multiple private equity firms can partner on investing in an asset. It isn't one for one. The largest deal being a single $13 billion deal, which was incredible. And over the past 5 years, there has been over $51 billion invested by private equity just in the behavioral health space. So I just think that is an enormous number. When you think about how many folks in LSA, if you combined all your revenue, would you make $51 billion? That is just an enormous amount of money. That's an enormous amount of leverage politically, through advocacy, regulatory, all of those things, negotiating with payers. If you think about the scale and the size of that, it gives them a very big seat at the table. And it's one of the reasons to be paying attention to what they're doing in our space as colleagues. This is the same data just shown over years. I wanted to show you just year trends. Certainly 2021, the first full year after COVID, was a huge influx of private equity and behavioral health, most of that money going under mental health because we had such a high utilization of mental health services. That was a very hot investment focus for private equity. And you saw that deal flow jump way high in 2021 and then kind of settled back down to 2022, the same as it was in 2020 levels. We are seeing 2023 play out at nearly the same volume as last year. So while folks have said the private equity investing in behavioral health has cooled, it certainly is not cold. And we anticipate the numbers to be just about the same as they were last year. So a couple of things that private equity can learn, or that nonprofits can learn from private equity, right? I think the business acumen piece is worth stating. And we intentionally made this pyramid with the weights on the bottom here. You know, no margin, no mission. If you've heard me speak before, I say this all the time. Mission mindset, business mindset are not mutually exclusive. Nonprofits absolutely can and should be in business to make money as well. It's what you do with that revenue that sets you apart. Using data and not emotions to drive analysis of service line, whether that's, kind of business information analytics, whether it's EHR, whether it's tech services, data dashboards. We are now a data rich, and technology is a huge part of our service delivery. And we have to use that to make decisions for funding, for management, for growth, all of the things. Private equity does a great job at investing in technology and reporting systems and outsourcing any of the pieces that they don't do well. It strengthens their back office, it strengthens their margin. And I think historically, nonprofits have tried to do everything under the same roof. And only in the last year or two have I seen more nonprofits outsourcing things like revenue cycle or billing or fleet management. It can be a distraction from the service delivery. So that's another piece to learn. Understanding and developing systems of scale. Can't underscore this enough that, some states have just hundreds of nonprofit organizations that are $50 million and under, which are relatively small organizations. And the system just won't support that going forward. I know a few weeks ago, many of you know, there was an announcement made that the organization of Marikey is merging with the organization of Elwyn, and that will create the first $1 billion nonprofit provider organization in our country. I think we're going to see a lot more of that, and smaller nonprofit organizations really need to think about combining for scale for many, many reasons. And the last piece is really a constant self-assessment, an annual self-assessment, either adding subject matter experts or fractional leaders, looking at what your strengths are, very, very strategically looking at weaknesses. We have a free self-assessment tool on our website for nonprofits. You can download it and use it. I think it's very important that we look at ourselves as organizations, just like private equity looks at an asset they will look to acquire, and a really rigorous metric to look at everything around service line, unit cost, HR, billing, all the pieces, so that you can improve your margin to the degree that you can. I've said this slide before too, just have a couple more to show you. This was last year's anchor event. Savita is the largest for-profit private equity-backed provider of IDD services in our country, and they spent about $100,000 at Anchor last year by my calculations to sponsor the bags and the lunch and the happy hour. And you might ask yourself, why would you do that? Well, one of the reasons they would do that is they certainly want to be known by smaller organizations who need to find a home through acquisition. They want to be that home. So they have, and private equity typically does a pretty robust spend on marketing and awareness campaigns. So just to round off the last few slides till we get to our discussion, I wanted to give you an example of what the logos look like for private equity-backed providers. So if you see them around social media or around town on billboards, you would recognize them. Here are 4 of the largest IDD providers that are PE-backed. Substance use disorder services. On the left are the more traditional brick and mortar providers, and on the right are the mostly digital or hybrid virtual tech providers and providers of services that do in-person and virtual care. Private equity-backed behavioral health providers with some autism providers in there as well. And then pediatric mental health, seeing a real uptake and an interest in PE around pediatric services. And lastly, this is very new in the last few years. I've spent my whole career in SMI services, seriously mentally ill services on the Medicaid side. I have never seen private equity invest in this space until very recently. But here are 5 SMI providers that are PE-backed. Really interesting to see them get into the space as well. So you'll have these slides. We have my email and phone if you need to contact me afterward. I'll stop sharing so we can get back to Kent and our moderated discussion.
Great, thank you. Stacy, I'd love to ask just a few more questions. So
sure.
Really intrigued by your slide around restructuring of board duties and what that looks like. The workforce issues are top of mind for everybody, and I assume they care about that too. So
of course,
how does private equity think about that, or how do they address that if they're looking for deals? What does that look like?
Yeah, I mean, pain point on staffing all across the board in every industry, right? Not just in ours, but in hospitality, hotels, education, nursing, you name it. So that is almost table stakes right now for an issue to address by any organization. But they are worried about that just like we all are. And I think the edge that they might have is one of 2 things. One, with technology and a real core investment in technology, you can make your work experience more attractive and user-friendly to DSPs, right? So if you have something like ChatGPT that's writing your notes for you or dictating notes, and you have to do less around point of entry laptop, that may be attractive to a DSP over a traditional nonprofit organization where it's still heavy on writing or typing or desktop-based services. The same for any kind of HRIS platform. If you have benefits and things that can be pushed out through text, much more friendly for employees. And then there's always the wage issue, right? If you have a higher margin, you can pay a higher wage. So those types of things and scale, I can't underscore that enough. Most of the private equity backed providers are larger platforms, and they could be part of other systems. So if you're paying for health benefits for 400 staff as opposed to 4,500 staff, you're going to get a much better deal on your health insurance and provide that savings to your DSPs. So I think some of the savings around technology and scale is where they may have a slight advantage.
Okay, and scheduling software, that one comes up a lot. Is that something private equity invests a lot in?
Yeah, I mean, any kind of streamlined process. They are very, very heavy in looking at process and how to automate those processes. So anything that can be automated would be automated.
Okay. Another question, a lot of of course, our members receive a lot of government funding, and a lot of the members, folks they serve, are on Medicaid, Medicare. Is private equity agnostic about private pay versus folks on Medicaid, How do they weigh those calculations and decisions? Is one more attractive, less attractive?
Yeah, that's a good question. I mean, I think at times it can be good to, not have your eggs all in one funding basket, but at the same token, from my experience, it can be a distraction to have too many ways to bill. So I find less on the IDD side, there isn't much self-pay there. That's mostly waiver-based and CMS services for the most part. I think where on the substance use side, you see more of a separation there as a private pay commercial versus a Medicaid population.
Got it. Thank you. Well, I have one last question, then I'll open it up to you and Linda and George. So private equity invests, right? But traditionally, right, they're trying to exit, correct? If that's fair to say, not necessarily?
Not necessarily. So there are some funds, Seven Hills Capital is a great example. They're based in Nashville, and they do more of what we would call like a 10-year hold. So they invest to create value and service delivery as well. You're right, though, Kent, the life cycle of a private equity hold, as it's called, is usually 3 to 5 years. But there are some companies that are in it for long-term investing, long-term support, and Seven Hills is one of those examples. So that is sometimes a misnomer. It's not always a fast flip as the goal.
Yeah. And so last question, if they do flip, who are they looking to sell to? What kind of buyers are those folks in that industry who now see profitability? Who are the buyers on that side of the?
Typically, it's another PE firm. So, if you look at something like Caregiver, for instance, Caregiver is a large IDD provider in multiple states, and they were owned by Council Capital, held for 3 years, and then sold to, I think, Vistria, another firm that purchased them. So it's typically just one firm to another firm.
Okay, got it. Okay, I want to open it up, make sure we get Linda and George, our other experts, into the conversation. Really want to see if either of you would be willing to weigh in on anything you heard, but also the IDD space being funded by private equity. What does that mean for you? What does that mean for the folks on the call? That can go to George or Linda. Linda?
I'll jump in. George, you can follow. I think when we originally heard that private equity was entering our space, we were very confused by why they would do that. So for example, at Mosaic, our target margin is 1.5% to meet our bond covenants. That's the minimum, right? So when I hear private equity firms, and Stacy was at the same meeting I was, say they look for a 12 to 15% margin, I'm confused and concerned, right? One of the concerns I have right now is that with the funding uncertainty due to all the economics, right? During COVID, we were blessed by having additional funding. That has gone away. Rate cuts could be coming depending on the economic situation. How will private equity view this decrease in revenue that they saw when they made the purchase, right? And then again, who will buy them? So would another private equity firm be interested in that? Or are they going to come back to the nonprofit sector and ask us if we would be willing to purchase those services back? And we often couldn't afford to pay what they paid for them.
That's right.
I think Linda brings up some great points. I believe that we still have an attractive book of business, meaning IDD, and I'll give you a little bit different perspective. I spent 20 plus years in the private sector selling services, and I believe that we really control the customer and who the customer is. And in this context, I'm talking about the client or the person served. And what private equity is attracted to in that model is the connection points that the client brings for selling other for-profit services. And I'll use behavioral health in its traditional sense, not in the broader sense that Stacy said, but approximately 50% of the IDD population in a recent survey needs some type of mental health or behavioral health supports. And that's followed by primary care. They need to have a primary care doc that can be assigned to them so that we can reduce the amount of emergency ward and enhance their care, amongst other things. I believe that private equity has figured out new delivery models for delivering both of those services in addition to others. And just the fact that I'll speak of Altair as a collaborative, that's the group that I represent. We're approaching 23,000 clients, and access to those 23,000 clients and be able to repetitively implement a national primary care firm, a national mental health firm, and other ideas that I could go into in greater detail, is of great value. And while I can't necessarily put a value on that, I have talked to investment firms about how they are thinking about that value over a 10-year period, because our customers have, our clients have a guaranteed funding mechanism in the waiver system. So I'm going to say their base services are paid for. And even though, to Linda's point, we're facing some reductions to base services, my instincts are we're going to weather through that with new designs that are underpinned by technology. And the investment firms know that, and they too have already figured out how they can bring this technology. So to kind of summarize my point, I think our greatest value in the IDD sector, especially when you see them coming after the purchase of group homes, is that access to the client or the customer.
Thank you, George. Stacy, did you want to build on that?
Yeah, you're absolutely right. I mean, when I've asked folks, like, off the record, to Linda's point earlier, like, what are you doing in this space? No one's getting rich here, right? This is not what you think about when you think about earning 12 to 18%. And what George has mentioned is absolutely right. They view this as a lifetime income opportunity, right? Folks don't cycle out of IDD services. They're in it forever. And the additional ways that they can create value or higher revenue is through technology, through streamlining systems, and through adding on additional services that can be paid for that folks don't traditionally have. So whether that's mental health, whether that's medical, whether that's supported employment, whatever it may be, those services added with others are kind of part of that long-term revenue platform. I wanted to address one of the questions I saw too about private equity in the social service space. And I thought that was really interesting. I've never seen that. That's not to say it doesn't exist. But if you think about things like child welfare or community counseling, refugee services, that is not something I have ever seen private equity invest in, to my knowledge. So really interesting.
One of the other questions we wanted to pose to you, all three of you today, and then I'll get to another audience question here, is how to be competitive in a bidding process. I think, Stacy, you touched on some of the ways nonprofits might need to rethink value and what they offer. So maybe it's some of going back to that, but I'd love to hear from each of you. And if there's any story you have about being in competition with private equity, we'd love to learn from a story.
Yeah, I know Linda has one. I can tell you, I represent a client who was approached by a PE firm who wanted to divest some of their business. They had multiple lines of business and they wanted to divest one part of that. And, the price, tag was quite high and you weren't really getting anything. There was no real estate. There was no, brand new cars. There was nothing associated for that value, but they had in their mind, I think of it like a garage sale, right? When you try to sell the painting that you had hanging in your college apartment, that's probably worth $1.50, but to you, it's worth hundreds because you paid hundreds and you saw it forever and it has sentimental value. Not to say that IDD has sentimental value for private equity, but they overinflate the value based on what they paid for it. When you're really just buying contracts and hoping staff stay and hoping clients stay where they are. So the price tag was, in a couple of $1 million. There wasn't anything you get for that couple of $1 million, but the opportunity to serve people. And so, my client passed on it. And then the next step would really be for them to go to the state and say, look, we went out of this business. Can you give our contracts to someone else? So, that's my experience with that.
Okay. Linda?
Yeah. I had very similar experience to Stacy. We're just dealing with that now with a group that's actually backed by Bain. And at first they offered to sell to us for a nominal value. And now they came back and said, would you just take it? But really the need to invest in services, in wages and benefits for employees and capital expenses is significant because those things had deteriorated during that ownership. Just as Stacy said, there are some private equity groups that don't do it the right way or know our business. On the other hand, we're often approached by brokers. We're large. And so about almost 400 million in annual revenue now. And so when brokers come to us with an opportunity, they like to say, you're a preferred bidder on this opportunity. And we have our general counsel and CFO work together and go back to the broker and really try to understand what is the motivation of the seller. Right? So we've had experiences where we've done acquisitions and been in a competitive process where the sellers really are looking for preservation of mission and continued impact. Right? That's a great partnership for us. If your intention is, I want the top dollar I can get from these bidders, we're not your partner. That says a lot about your motivation. That's fine. It's a business you built. But it's probably not something that's a good fit for us. So that's been some of our experience.
Wonderful. Different way to compete for sure. George, how about yourself?
Well, I think, those are good examples. I was sharing as we were chatting before we opened it up to everyone about a recent experience that I went through as one of the customers of a firm that was acquired for all the reasons why Linda wouldn't acquire. And I won't mention the name of the firm, although it's public, so I'm not hiding anything, and I'll be happy to provide it if anyone's interested. But it was a firm that was very strategic to Altair. And was starting to get some national traction. And in fact, Linda even knew 5 years ago that I was really trying to work to take this national, to build the momentum. And it was part of our integrated care model. So it was quite important to us. And a private equity firm came along and made a ridiculous offer to the two founders, a father and the son, and suddenly all of their passion about the person and the sector and human kindness, et cetera, and I'm not trying to minimize it, went by the wayside, and all they saw was dollar signs. And even though I've been a businessman for a long time, and I have learned to be more humble in the nonprofit sector, it really shook me up, because this was going to have a dramatic effect on our business, on Altair, and has, and I'm still recovering from that, and I'm trying to decide whether I should dance with their new investment group or not. So I share this because we as nonprofits need to keep our eyes wide open to not necessarily being acquired or being interested in a deal, but being part of the after effects and how it affects you. And I'd be interested if Stacy or Linda have any other comments on that. But I'm a little raw from it, so if I'm emotional, I apologize. But it really is happening, and I think we can expect more of it.
You're absolutely right. And I'll give you a great example on the substance use side with methadone clinics, which are very popular, and that's a very popular platform for private equity for many reasons. I often hear clients, most of our clients are nonprofit organizations. So I'll just say that first off, most of our clients will say, or if I'm at a conference talking on this, they'll say, well, I don't need to know this because I would never sell. My board would never let us go to private equity, or I would never sell to, or we would never entertain that conversation. And I guess what I'm saying is you don't need to entertain the conversation because they can set up and scale, to George's point, around you. So on the methadone clinic side, I worked with a client and who had that as part of their business. And they said, a P firm that backed a larger provider wants to acquire this, and we're not letting it go. We've had it for decades. It's part of our service array, all the things. And then what the PE firm did was they set up on the next block, and they opened a methadone clinic that was newer, nicer, cleaner, paid staff more, tech-enabled, sort of scan in, scan out, all the bells and whistles. And what do you think happened? Right? The staff kind of went over to work there. The clients started going over there. They made deeper relationships with referral sources. And before you know it, they had the lion's share of the business in the neighborhood, and the other organization folded. So to your point exactly, George, you can't deny the presence. They are here. We can't wish them away. They are not all bad. So I want to say that as well, right? They are not all bad, but we have to be aware of the part they play. If you look at a state like Ohio and you look at IDD providers, 50% of the providers in the state of Ohio are private equity backed, 50%. So you cannot ignore them as a colleague and as a part of the system serving folks that we all care about.
Thank you. Thank you, Stacy. I want to get to one question that's been in the chat. What do you think about the recent New York Times article on the Carlyle Group private equity investment in Manor Health? Did you get a chance to look at that, Stacy, or others on the call?
Linda, you want to jump first?
You go first.
Okay. I did. And again, it's, stereotypes exist for a reason sometimes, and these are all things we know about private equity. I will say, I think that is more rampant on the nursing home side than in the care side. I've seen that much more exploited, or appears to be much more exploited on that nursing home care side. More, I think, controlled on the IDD and mental health side, as certainly, our industry has a lot of regulatory pieces in place and more legacy providers than on the nursing home side. So I think there's a little bit of a difference there, but it's just as easy to find an article on for-profit organizations that have done something that folks think isn't right either, whether it's paying the CEO some ridiculous amount of money, or kind of shorting services, or working on some other kind of deal that the board has. We've all seen that across our time in the space as well. So I just tend to not want to polarize the sides. Like, nonprofits are not all wonderful and good, and private equity is not all, evil criminal. So I just want to be really careful. We're not there's enough divisiveness in the country. I don't want to add to that in this vein, but, I do think that there's things to watch for, right? And I don't think we can ignore the piece they mentioned about, the legislative, muscle that's there. Private equity as a whole is a very intense lobbying power. And I think that, across all sectors, that's something we look at. And we have things like Anchor and NatCon and advocacy groups of our own, but they are certainly not funded to the degree that private equity can fund to influence, on that legislative side. So that's the piece that jumped out for me.
Linda?
I do think too, more broadly, Stacy's kinder about it, and I have a definite opinion about private equity, and we've transitioned some business to a private equity firm. So I can't say that I'm excluded from that, but I think there are going to be some unintended consequences. And I think organizations can get too big to fail, and a state cannot afford. So they kind of get over a barrel because an organization has bought too much business. I think there needs to be more regulatory oversight in terms of expenses, regulatory compliance, those kinds of things, because there's a different motivation. And I think part of it is if private equity does not put in management that understands the business and the services delivered, they are going to be focused on the financial aspect of the business. And that's to the detriment of people, in my opinion.
Great. George, I know you're in Minnesota. You feel free to speak to public policy or to other dynamics.
I agree. And I don't see this going away either. So I really don't have anything to add except to say, really sending a message to people to pay attention to this, whether you're medium or large.
Mm-hmm. Well, and you can't ignore, the not only private equity, but the corporate side investing in our space. When you look at Amazon and you look at One Medical and you look at CVS and Aetna and providing behavioral health, and we start to see the chain of service delivery go deep, and we know what happened to the local bookstore when Barnes & Noble came, and we know what happened to Barnes & Noble when Amazon came, right? And now they are also kind of putting, roads into medical care, primary care, prescription care, behavioral health, IDD services to come at some point, right? So we have to not only look at private equity, but we have to look deep in, follow the money chain of who else is investing in our space and why, and what does that mean for us as legacy nonprofit providers and communities.
I also think to really follow up on that, Kent, that as the question came about the other social services, those are not lucrative services for private equity. There's not the scale. I mean, look at refugee services. You turn on the faucet, you turn off the faucet, right? I mean, it's very complicated. I'm afraid there will become this core of services that are so vital to our communities that will be left out in the cold while other organizations are subsuming the public policy, the money, the this, the that, and that would be very unfortunate. And so I think from a social services perspective, we have to watch how do we create scale on our own to continue to do the things that are important for our communities and for the reasons we do them for.
Thank you. Thank you. I wanted to, we have a little more time. I want to ask one more question about, and Stacy, maybe you're best positioned to answer this. If folks on the call want to find out more about transactions, you had that great slide that are happening in their community, their state, their city, region. Where can they go for information? What's a reliable source?
It depends on how big the checkbook is. Okay. Because the best source of information is a company called PitchBook, which we don't, I mean, it's too expensive for our firm to use, about $16,000 a month. and they are the repository of all the transactions. So there is, because it is not nonprofit and it's not government work and it's not, on the CMS website, like most of our services are, it's very difficult to find that information. So unless you're combing through all of the resources that announce deals all the time, which we try to do, you have to partner with an agency or an organization that, uses PitchBook and get that data. So our friends at BRAF gave us that data, but it is not easily obtainable. So it's very, very tricky to find all that.
Good. Okay. Well, we have time for some closing remarks. So I just want to give each of you an opportunity, something you want to stress, something you encourage our folks to look at, to learn more. George, maybe I'll turn to you first. Any closing thoughts for the community here, the audience here?
Well, I think Stacy's done a great job with her overview today, and I would really take some time to review that, and listening and watching what is going on around you is really important. I just came back from Anchor, and I thought that was an excellent opportunity to talk to your peers about what's going on in your market. So be vigilant. Don't be afraid to ask questions about private equity and what they're seeing. If you're approached by somebody from private equity, don't go hide in a corner. Start talking to them. Just don't tell them anything that you would consider to be confidential, but take notes and learn from that process, and take it back to people you trust for discussion if you're interested. The last thing I'll say, it's good to know where your board is on this. So encourage you to at least have a discussion with your board so you know directionally what they're thinking. Linda?
I would agree with that. I think the landscape has changed. And I hesitate to use the term market because I think we do what we do as members of LSA for a different reason. But it's changed, and you can't ignore that. And your environment's changing. So I agree with George. You've got to be looking up and out and having a conversation and learning. To do nothing will create a problem for your organization. You have to have a strategy around sustainability in this new landscape.
Wonderful. Stacy.
Yeah, I echo both of those things. And I guess the challenge is to us as leaders of nonprofit organizations to think about the way you bring people up through your organization. The for-profit side brings Ivy League and business acumen and MBAs, and then they teach them about human services. Right. And what we do typically, folks in LSA, and certainly my experience was started as a clinician and came up through the ranks of leadership because I said yes to things and I was friendly and I liked people and I believed in the services, but I didn't know anything about running a business until I was taught along the way. And the first time someone asked me into a leadership role and they said, well, you'll manage your P&L. Can you do that? And I said, sure. And then I went home and I typed in, what is a PEONEL? And I had no idea, right? So I think what we need to do as nonprofit leaders is reach down deep and start training folks who have potential on business skills and operational skills. There's no pejorative to making a margin. We should be doing that. So I guess what I would say is really let's look within and strengthen the leaders we have so we can better compete.
Thank you so much. Great wisdom today from each of you. So appreciate that. Please join me in thanking George, Linda, and Stacy in the chat. Thank you all so much for your expertise and your time today. I did want to note a couple strength and service webinars that are coming up. I'm hopeful we can continue this discussion in other ways, but we do have two more, one on June 13th at 3 p.m. on innovative strategies for social determinant of health screenings and supportive connections. That will be with our Enhanced Care Management Group, a collaborative of organizations across the Lutheran social services community who have been meeting and discussing these issues and are ready to share some insights. And then June 20th at 1 o'clock, we'll talk about maximizing opportunities using HUD project-based vouchers for assisted living, which may be of interest to many of you. So again, thank you so much to our speakers today. Thank you, Stacy in particular, and Linda and George. Thank you all so much. And thank you for joining today. We're stronger together. And so thank you for joining the Strength and Service series today. Appreciate it. Have a great rest of your day.
Thanks, everyone.